I'm John Giever with MedPage Today at the American College of Chest Physicians meeting in Philadelphia. A study presented here highlighted a potential problem with blood products as they near the end of their standard storage period.
We decided to evaluate the effect of the age of the blood from the donor to the recipient and its effect on infection, hospital-acquired infections. So the design, really it was a retrospective study, which is like we studied charts from patients who were admitted to the hospital between July 2003 and September 2006. And we reviewed their charts for parameters that included demographic data. And we looked at the rate of infection in those patients. And those infections were vent-associated pneumonia, nosocomial pneumonia, urinary tract infection, sepsis, endocarditis. And of course bacteremia that would be line-related. We looked at secondary outcome like ICU lengths of stay, hospital lengths of stay, and in-hospital mortality. And for the blood data, we looked at the age of the blood, which is the time from which the blood was taken from the donor and then given to the recipient. And then we looked at the age of the first unit of blood given. And then we looked at the age of the oldest unit of blood given, and we looked at the impact of those ages on the development of infection. The results, just in summary, we had a huge number of patients that were admitted to the unit, like around 2,463 patients, and only 421 patients remained for study because either they were excluded because they were not transfused or we didn't have enough data. And most of the results were significant in the sense that we had, after we did the multi-analysis, the statistical analysis, we found that blood older than 29 days was associated with a 2.9-fold increase in risk of developing at least one nosocomial infection or at least one hospital-acquired infection. And if the first unit of blood transfused is 26 days or older, there is at least a 2.1-fold or two-fold increase in risk of developing at least one nosocomial infection. We found no association between average age of blood given or any age of blood given with the outcome of death, ICU lengths of stay, or hospital lengths of stay. And we did find that if a patient received 5 or more units of blood, there was an increased risk of infection with those patients. Because of the nature of our study being retrospective in the sense that we're reviewing charts and getting those results, we cannot draw major categorical conclusions, but we can caution towards packed red blood cell transfusion and limit its use as a way of limiting infection risk. And especially knowing with the limited blood supply, it's hard for us to advocate just using fresher blood for every patient. But from our results, I think it's clear that the younger the blood, the less the risk of infection.
I'm John Giever, MedPage Today.